Welcome to Fit and Lit by Confidence. I'm your host. Oh, I've even said my name. Well, I'm your host, Confidence. You're welcome to today's show. And first of all, like I always do, I want to thank you all for engaging, for liking, for subscribing. I'm seeing the engagement is so encouraging. Thank you so very much. How was your day? How was work? Hope you had a fruitful day at work. Please relax and enjoy the show. Today I'll be talking more on women's health. Next week we are going to talk on men's health because people don't care about men. They feel like men do not have health issues to deal with. But I'm telling you, everybody has health issues to deal with. But let's take today to talk about women's health. I'm going to be talking about some of the major causes, the effects and solution of so many health issues that women have. So today we'll talk about something that affects every woman in the room and every woman you love, be it your wife, your sister, and even your daughter, be it your cousin, your nephew, your niece. Yes, your niece. We're going to talk about their health, and we are not going to talk about this to discourage you, or maybe some of them are already facing health issues. We are not going to talk about it to discourage you. We just want to talk about honest practical steps, the causes of some of those health issues these women are facing, and the solution, because they say knowledge is the answer to almost everything. So let's dive into our study or our topic for today. Today we are going to first talk about the reproductive and hormonal health of a woman. This is a broad topic. We all know that the reproductive health of a woman is so complicated. Somehow, the woman goes the woman goes through body development changes, the woman goes through childbirth, the woman also goes through postpartum after childbirth, postpartum season. It's just too complicated. And will I say it's back to back? But what of if so many women do not understand this cycle? What of if they do not really understand what their body is saying at a particular time when they are growing up as girls, when they get to adulthood stage, when they get to teenage stage, and they are seeing different kind of fluctuation in their body system, and they are not, they are still confused. They don't have proper guidance on what to do at that particular time. That is why we are here for you. So the first thing we are going to deal with under reproductive and hormonal health is your menstrual health. A few weeks ago we were talking about menstruation of the girl child, and we said, first of all, we broke the stigma that there's nothing to be ashamed of during your menstruation. It's normal. That is how God created it, and it's very important. It is what makes you a woman. It is what makes you complete. Will I say complete? Because truth is that if you don't go through this menstrual phase, you might not really get to give birth. I've not heard of story that somebody did not go through the menstrual phase and she gave birth. I have not heard of it. But if you don't go through this menstrual phase, you might not be able to give birth. So understanding your menstrual cycle is very important as a woman, as a grown-up woman, down to post-menstrual, what the menopause, down to menopause. Understanding your menstrual cycle is very important. And I said sometimes, what are the causes of understanding your menstrual cycle? We have causes here. Maybe the kind of fluctuation that you feel during your menstrual cycle. First of all, what is menstruation? Menstruation is a period of time where a lady sees blood coming out from her private area, and this blood is coming directly from the womb. That is the simplest form, and that is how I can explain it to a simple form, because we have young girls that are also watching this video. So whenever you have not seen blood before and you just see that there's blood coming out from your body, and especially when you are not cut down there, you might likely be having your period. Please, there's nothing to be scared about, because like I was saying a few weeks ago, when I first saw my own, I was scared. I was like, what cut me down there? There's nothing to be scared about. You just need proper guidance. So now, what are the causes of hormonal fluctuation, during your period? You have stress. Your hormone changes. Normally, menstruation comes with change in change in everything about a woman. That is when a woman gets angry. That is when her mood will just change. It comes with different things. So when you are stressed, When you have poor diet, you also notice weight changes. Yes, it could happen during, you still, it's not even during, before you just start noticing that your mood is changing, you are easily stressed, and you just have different kind of moods. The effect is sometimes it can bring mood swing, bloating, fatigue. You will just be checking and you see that you are fatigued. And sometimes there are underlying sicknesses like PCOS or thyroid issues that accompany menstruation too. We just have to watch out for all these things. The solution is tracking your menstrual cycle monthly. Eat food rich in iron during that period. Please, that's not the time to be eating junk. I've heard some people say that when they are doing their menstruation or when they are going through their menstrual cycle, that is when they want to eat junk, chocolate, ice cream, sugar, sugar, sugar. Please, that is not the time to eat that. This is the time to eat food rich in iron. Eat ugu, eat beans, and eat liver during this period. It will help you a lot. Then see your doctor if your cycle is irregular. Please, more than 3 months. Some people have irregular cycle. We have gone that. You can check through our videos. You see where we extensively talked on menstruation. Some people have irregular cycle. Some may not see their period for 3 months, and it's not that they are pregnant. Please, always learn to go to the doctor and hospital, sorry, and see the doctor. We have this habit of not going to the doctor. We have this habit of not going to the hospital to see the doctor. We are always self-treating for everything. It's not a good habit. Number two, we are talking on fibroids. What are the causes of fibroid? We have excess estrogen production. Excess estrogen production. We have family history and genetics. Yes, like I was telling somebody a few months ago that sicknesses in family history, they really occur. They twice occur, they thrice occur, they four times occur. And they might occur in generations that may not be even suspecting anything. They may not even know that this is what their grandparents passed through. So we also have high fat, low fiber diet, and obesity. Yes, obesity is one of the cause. Please watch your weight. Learn to watch your weight. First of all, learn to watch what you put into your mouth. People who eat junks, who eat chocolates, who eat, I know somebody is out there saying, but I've been eating chocolate for a long time and I cannot feel anything. Please just learn to watch your weight. It's very important. If you know that there are certain food that you eat and it makes you grow fatter, it makes you add this kind of unhealthy fat. There's healthy fat and there's unhealthy fat. Please learn to watch what you put into your mouth. So instead of the normal cycle of period or the normal days your period should be stopping, your period gets prolonged and it causes anemia. You have pelvic pain or pressure on the bladder. You are always urinating, going to the toilet to urinate. You go to the toilet to urinate. You go to the toilet to urinate. Is might be that you have fibroid. You have pelvic pain, just like that. Your pelvic will just start paining you. And you know, the woman, our body, almost everything is paining us in our body. Almost everything pains us in our body, and that's just the truth. But when your pelvic, you are having pains right there under your pelvic in your abdomen, please try and see the doctor. You might just be having fibroid. You have fertility challenge, yes, and pregnancy complications. Sometimes I heard that a fetus and fibroid may not be able to grow side by side, and sometimes the fibroid might be bigger than the fetus and might be taking the nutrients that the fetus is supposed to take and be growing. Yes, fibroid grow in the stomach. So those are some of the effects. Now, what are the solutions? Although they do more of operation for fibroid removal, but eat more vegetable, less processed meat. Eat more vegetable and less processed meat. Seek ultrasound for diagnosis. Please do not self-treat. Don't be saying, I want to palpate. I want to hey, this place is strong. This place is not strong. This place is... Please do not self-treat. And do not use abo. I heard that some abo used to work, but I prefer you still going to the hospital. When I was in Ekiti in 2018, when I was serving during my NYC, I served in Oyo Ekiti. I got to know that there's a particular local medicine that they give women who have fibroid, and they defecate the fibroid. And truly, I saw it work. But I still say, go to the hospital, get a proper ultrasound check, and get fibroid removal. The hospital technology has gone far. They can always operate it and remove it. Get a proper, just be make sure that, because make sure that you are in safe hands. The hospital is a safe hand. The doctors are safe hands. But this local medicine that you are drinking, that they are mixing different leaf and different leaf, might do the work, but it might affect something later. So go to the hospital. Medical and surgical. Another thing that is common to women is PCOS, and it's polycystic ovary syndrome. Polycystic ovary syndrome. What are the causes? Insulin resistance, when your body is resisting insulin, and hormonal imbalance. I want to break one myth that concerns PCOS. Please, when you have PCOS, you are not less than any other woman. When you have any of these health challenges I'm talking about here, you are not less than any other woman. Please do not see yourself as less, because I know some women get ashamed when they see PCOS. Can be the PCOS causes a woman to grow beards. She grow excess hair on her body and might likely have beards. Please do not shame women that have PCOS. You cannot create anybody. So that's the myth I want to talk about. And what are the causes? Like I said, excess insulin resistance and hormonal imbalance. When your hormone is not balanced, and insulin resistance, there's insulin, your body is just rejecting insulin. Yes, you have excess male hormone production, like excess androgen in your body. That's why I said sometimes you see some women growing hair, sometimes you see a woman having a man's voice, sometimes you just see a woman having muscles. She may have excess male hormone. Genetic disposition too is also there. What are the effects? Number one, we have irregular period, unwanted hair growth. That one is even very, very common. That hair growth, when you see a woman having beards on her chest, having hairs on her chest, having hair where it's not supposed to be, does not make her feel less than a woman. Please, weight gain, especially around the abdomen. You see weight gain, maybe somebody has big tummy, especially unusual big tummy around the abdomen, infertility and risks of diabetes. Now, what are the solutions? Like we said, to everything we have a solution. Reduce sugar and refined carbohydrate intake. Please reduce your carbohydrate, eat more of protein. Exercise regularly is very important. You know, we have been emphasizing the importance of exercise throughout our series that we have been taking. Exercise is very important, and we said you don't have to go to the gym, or you don't have to break a bank to do that. Trekking is an exercise, running is an exercise, dancing is an exercise. So exercise regularly. Medical treatments are also available. Do not suffer in silence, which is very important. Number 4, we have endometriosis. That's if I pronounce it well. Endometriosis. And what are the causes of endometriosis? These are tissues similar to womb lining that grows outside the uterus. The uterus that is supposed to carry a child. Now, we have some tissues that now grows outside it. These are some of the causes. You also have immune system dysfunction. When your immune system just stop functioning as it's supposed to function, it gives you that. Then when your blood flow backwards, there are so many things that you just like that, your menstrual blood flow, instead of flowing down as waste, it now flows backward. Number 1, you have the effects are extremely painful periods. Sometimes you have painful period that you just say, it's normal. Excuse me. I used to have painful cramps. Painful cramps is normal. When I've seen people that have painful cramps that they admitted them in the hospital, it's not normal. It's not normal. It's not a normal thing. Some, they put them on drip for days till their period is over, and they are going to the hospital every month. It's not normal. You might just be having endometriosis. You also have pain during sex and bowel movement. Maybe you want to go to the toilet, you're having serious pain. And then when you are having sexual pleasure, you are having serious pain. It might just be this, and it can cause infertility. If you notice that there is a common thing in the three issues that I've talked about now is infertility. That's why women will need to take our health very, very serious. It might cause a permanent damage to us. What are the solutions? Number one, advocate for yourself. I've told you, painful periods are not normal. Please go to the hospital. Go and see the doctor. Go and see a gynecologist. Please, it's very important. Now, hormonal therapy and surgery treatments are also available to clear all those tissue outside the womb. Menopause, yes. And these days, we have all heard that menopause, the age of menopause has come down. So some people get to menopause around 30, 31, 32, some 40, some 45. It depends on body. Like we said, our body is not the same. Our system is not the same. The human A is different from human B. Human B is different from human C, and that is what makes us unique. So, what are the causes of menopause? It's a natural decline of estrogen as the ovaries age. As the ovaries age is a natural decline of estrogen. It's also the causes are surgical removal of the ovaries. Maybe they remove the ovaries, maybe the woman do not want to have children again and they remove the ovaries. Premature menopause can occur under 40. You know, I just said it, there's premature menopause. Normally 40 is the age for menopause, but there's premature menopause. What is menopause? Menopause is when your period stops, when you don't have any menstrual flow again. That is what menopause is. It's a pause, or I even heard there is menopause, but menopause is when you don't have menstrual flow again as you age. The effects are hot flushes, you have night sweat, sleep disruption, maybe you can't sleep at night. You also have vaginal dryness, mood change, bone loss. You have increased rates of heart disease. You are risk, you might likely be at risk to heart disease on your menopause. That is the effect it comes with. What are the solutions to stay healthy during menopause? You have calcium-rich food and weight-bearing exercise that protects the bone. So exercise is very still important. There's this woman I used to watch on Facebook that does exercise, and she's very proud of her menopausal stage. And if you see her, she's looking so hot. Sorry to say, she's looking so good, she's looking so fresh, and yet she's very proud of it, but she does exercise. In fact, that was what drew me to her page. She does exercise. At her home, she does exercise. And if you see her, very kept, very kept. So exercise is very important. Emotional support and community, it reduces isolation. So in case you have gotten to your menopause and you have not had an issue, please check out for emotional support and a community that can support you, and don't isolate yourself. Very, very important. Yeah, now we are coming to maternal health, section 2. Very important. Number 1, antenatal care. Women that are pregnant, please don't take your antenatal for a joke. I know that there are some drugs that you are supposed to take at each step of the way, and you can only hear it in the antenatal hospital where nurses are. No matter it might be local antenatal care, it might be maybe you are in a general hospital, you are in a private hospital. Please go for your antenatal appointment. It's very, very important. Many women used to skip this visit due to cost or distance. I don't think they collect money for antenatal care. It's free. They don't collect money. Go for it. You don't have an excuse. Please, your child is very important. You yourself, you are very important. You need to hear from experienced women. You need to hear from the doctor what you. I think that at some stages they will even give you some injection. They will give you some injection. So you need it. You need that antenatal visit. Cultural belief also that pregnancy manage itself is a big lie from the pit of hell. Every woman has different pregnancy symptoms. Every woman. Like I said, there are changes that happen in every woman. The change that happen in woman A might be different from woman B, might be different from woman C. So pregnancy does not manage itself. At every stage of the way, you need encouragement, you need knowledge to handle the next month. Low awareness too of women, because now I don't think that's possible, Sha, because even the most local women now, they attend antenatal. I know some of us say, now God they keep children, now God they keep. Please don't put yourself at risk. What are some of the effects when you don't go to antenatal? You might have mixed detection of high blood pressure and gestational diabetes. These two are very common during pregnancy. High blood pressure, preeclampsia, and gestational diabetes. When you are eating that time the baby is demanding for everything. It's demanding for sugar, it's demanding for sweet, it's demanding for coke, it's demanding for Hollandia, it's demanding for that rice that they use firewood and cook around 2 a.m. It's also demanding for some of you women. You are very, very, it's demanding for your husband to open his WhatsApp chat. We'll come to that later. But at the same time, please go to the hospital. Now, you might, when you don't attend your antenatal, they might not also, you might have fertile complications that are not detected. I know when you go to your antenatal, they check your heart, your baby's heartbeat, they check if your baby is moving. What if you are not now going? You will not even know whether your baby is moving or not. You will just be carrying something that you don't know inside your womb. Please, it's very important. Higher rates of maternal and infant death. Please, religion should not blind your eye. Go to the hospital for your antenatal. What are the solutions? Attend all your antenatal visits. Please, minimum of 8 is recommended by World Health Organization. Register at a health facility as soon as your pregnancy is confirmed. From the first day, you need information. Like I said, you need the information to deal with month 1, you need the information to deal with month 2. At when you are month 2, you need the information to go through month 3, and just like that till you give birth. Ask question at every visit. Please know your health matters. Ask question. If you are feeling back pain, ask question. If you are feeling small pain in the stomach, ask question. If you are vomiting, ask question. Please, knowledge is very, very important when it comes to pregnancy. Now, after you have given birth to our healthy baby boy and our healthy baby girl, there's something called postpartum depression. Many women just take it like, I'm just stressed. But do you know that postpartum depression can cause you mental stress? That you will see your baby, you will not want to touch your baby. You will just, I don't know, it changes your whole body system and thinking. And sometimes some people don't want to go to the labor room again. Now, what are the causes of postpartum depression? After you have given birth, there is a sharp drop in hormones after childbirth, and that is what causes it. You might have lack of sleep, lack of support, and lack of emotional isolation. Please, women, marry kind men. It is when you are pregnant that you know a man who is kind. You need all the emotional support that you need, because raising a baby from cradle, from day one, is not an easy thing. You lack sleep, you might not eat. The baby will be sucking everything inside your body, but you might not have the appetite to eat. That sleep itself is very important. It is when you want to sleep at night that baby will cry. So imagine you now doing all the work and going through this stress alone. It's a problem. Please, I can remember that as of that time when I newly gave birth to my son is 4+ by the way, but when I gave birth to my son, when he cries at night, after feeding him, it's my mommy that will take over so that I can just get a little bit of sleep. Because throughout the day he's eating, in the night too he wants to eat. And you know, boys eat a lot more than girls. Boys, children, they eat a lot more than girls. So you must have support. You must have support. Be it your mom, your sister, your husband, whosoever. Have emotional support. And maybe there's a history of depression or traumatic birth experience. Especially when you remember how you were crying, when you were being cut open. You know, you are very alive when all those things are happening. Please, it might cause postpartum depression. Now, what are the effects? Sometimes you are just in sadness. You are just imagining, why did I even give birth to this child? Why did I go through all the stress? You cry, and your inability to bond with the baby. You know, I just said it, that your inability to bond with the baby is another problem. Another thing is that you get angry, you get anxious, and you feel like a bad mother. When you cannot bond with your child, you are already feeling like a bad mother. So imagine what you are really going through. And in other cases, you might want to self-harm yourself or even harm your child. That's very, very bad. So please avoid postpartum depression by all means. Now, what are the solutions? Please talk about it. I'm I'm a fan of talking about everything. Talk about how you feel to trusted people, to matured people. You immediately you talk about it, you discover that your brain will be light. It just goes immediately. Learn to talk about it. To your pastor, learn to talk about it. To your mother, to your partner or your doctor, very important. Rest when the baby is resting. Please, when your baby is sleeping, some women want to do akaracha. They are very, when the baby just sleep, they have carried bike, they have gone to the market, they want to cook. No, 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 no. Please, those 6 months, 5 months is the time for your body to rest. Your body needs to rest. So please, when your baby sleeps, sleep. Get an assistant. Accept help. Should we help you? Don't worry. When I wake up, I will wash the plate. Strong woman. Very strong woman. You better rest. Your body needs all the rest that you can get. Then professional counseling and meditation can help both of you. Now, another one is maternal mortality, especially in Nigeria. Maternal mortality is when a woman goes into the labor room and don't come out. We see it every day. We work in the hospital, we see it every day. It's the most painful situation you can ever see. A woman who wants to bring out life with her own life taken. Sometimes she and the baby do not come out. Sometimes only her comes out. And very rampant in Nigeria, especially in the locals. What are the causes? Excessive bleeding during and after delivery, especially when you are in a quack hospital. Oh, God will provide for us to be treated well, especially when you are in a quack hospital, except issues beyond control. Except issues beyond control, please go to a good hospital where they can attend to you. Another thing is religious belief. This one is the one killing so many women, especially in the Christendom, where that you have to, the doctors want to perform a CS on you, and then your husband or your mother or whatever, whosoever will be saying, no, we are the Hebrew children, we cannot, the Hebrew women, they gave birth naturally. Were you there when the Hebrew women gave birth naturally? Sometimes you say some things and your head will just scatter. Were you there when the Hebrew women gave birth naturally? Please, CS is a natural birth. Vaginal delivery is a natural birth. Both of them are natural birth through different methods. And you too, you will be saying in the name of Jesus, and your child is getting weak inside you. You have a prolonged hour of labor. Your child is only getting weak, and you are saying in the name of Jesus, I will give birth like a Hebrew woman. Ha! Whether you give birth through, we have to remove this myth about CS. If you give birth through CS, if you give birth through your vagina, you are a Hebrew woman. For bringing life into the world, you are a Hebrew woman. So we have to take that note. Eclampsia, when you have high blood pressure in pregnancy, it can lead to maternal mortality. Infection, unsafe delivery, and delayed medical care. I was just saying delayed medical care, especially during CS. Now, one of the effects is Nigeria has one of the highest maternal death rates in the world. God will help us. Children are left without mothers and families are broken. Imagine your child left without a mother. No mother can ever be a mother to your child apart from you who gave birth to your child. I know there are worse mothers, but no mother can ever be like that. So we have generational trauma and poverty. Solution: register at a good health facility that have trained staff. Go to the general hospital, please. No general hospital, go to the federal hospital. At least the amount is low. Go to the federal hospital, please, and register well with a good hospital. Also, monitor your blood pressure during the pregnancy. Don't overthink. As a pregnant woman, you have the risk of getting high blood pressure. Please don't overthink. Where will money come now for the child? How will we buy clothes? I no get wrapper to carry go labor room. Even injection I no get. Slippers I no get. Please leave all that in the hands of God. God will provide. And please don't overdo. The little you have, take it and manage it. Also, Know your warning signs: severe headache, blurred vision, heavy bleeding. Some women bleed during pregnancy, like they just bleed. Please go to the hospital. When you see you are bleeding unchecked, go to the hospital. Another health thing that affects women is breastfeeding. Women, we are trying. May God bless every woman. See, I've listed how many things now for just for a woman. Breastfeeding. So, what are the causes of that? Some ills in breastfeeding. We discovered that many mothers stop early due to pain or low breast milk supply. Many mothers stop breastfeeding, and it is advisable to give your child breast milk throughout 6 months. No water. All those your grandma that say the child is thirsty, don't mind them. Breast milk contains a reasonable amount of water and food. That is why you have to eat. So when there's no breast milk coming out from your breast during breastfeeding, you have to go and see a doctor, or worse still, you have to improve your diet. Return to work stress, workplace stress, lack of workplace support, that can also cause issues in breastfeeding. Misinformation and social pressure to use formula. I'm of the opinion that formula are not good for children except for health conditions during that first 6 months. The effect: the baby becomes malnourished, it needs immunities that boosts antibodies in the baby. Also, there is higher infant risks of infection and malnourishment. The mother loses natural protection against breast cancer. So please breastfeed your children. By the time you are breastfeeding, that's how those men, they used to lie and say, if they suck the breast, the cancer. If you are a single person and you are giving them breast to suck, the cancer will disappear. When your child suck your breast, it reduces the risk of breast cancer. So what are the solutions? Feed your child exclusively for the first 6 months. Seek support, lactation support. You can pump. Science has made everything very, very easy for us. You can get a pumper, pump your breast and keep it in a cool place so that the baby can eat, so that the baby may not disturb you always. So you can fill as many jars as possible for the baby to take. Put it in. I used to see people, but I didn't do that. I exclusively fed my baby boy with my hand, with my breast. But you can do that if you know you are going to work, or as of that time I was not working. You can do that, so it can cut out stress for you. Lastly, bed spacing. Very important. Bed spacing. Now, what are the causes of too much children, like we see in the north here? Lack of family planning, knowledge, and lack of family planning access. It is recommended that a woman should give at least 2 years bed spacing to her children so that the body will have fully formed to be able to carry another child. But sometimes, without knowledge of all this, you just discover that they are giving birth to John, Amos, and sometimes they will senior themselves with months. Have you seen women that by the time their baby is just 9 months, they are pregnant for another child? I don't encourage it. Bed spacing is very, very important. Cultural and religious belief, they say, especially that one, they'll say, give birth to all your children at once. Now, when you go train all of them without even thinking about the effect on the woman's mental health, to carry baby almost immediately, on the children too. You don't think about the effect on the children. One is saying, mommy, mommy. The other one is saying, you are breastfeeding another one. The one that cannot even stand, you are already breastfeeding another one. With the stress and everything. Please, I don't encourage such cultural belief. Limited access to contraception. Please, there are different types of contraceptive. There is condom. There is IUD. There is implant. Although implant, women have been complaining about implant these days. I think there are pills too to take, which might change your hormone, but I think there are trustable pills like Postinor backup for the married people so that you will not be giving birth every year. Also, the effects are back-to-back pregnancy depletes iron and nutrients. I've just said it. It depletes your body. before you know, you are looking aged, you are looking haggard. Also, increased risks of low birth weight and preterm baby. So you are prone to give birth to preterm baby. People, children that don't reach maturity stage before they come out. Maternal exhaustion and higher risks of anemia. So what are the solutions? Wait at least 12 to at least 18 to 24 months. Like I said, the 2 years between pregnancy. At least let it be 2 years. At least, please, let it be 2 years. Very important. Discuss contraception option with your healthcare provider or your gynecologist so that we can know which one is more suitable for your body system. Family planning is not anti-faith. It is responsible parenting. Don't bring children into the world that you cannot take care of. Please don't bring children that will come and suffer. Do your family planning. No be who born pass o. Na who take care of your the children wey dey important. No be to get them scatter all those songs that you people all those our mothers of those days used to sing. I will see my children gathered around my table. Please hope that there is food on that table to feed those children. It's very, very important. So we have come to the end of this show, and I know that you have learned something, you have gained a lot, and like I said, I'm not a health personnel, but I try my best to bring out something out there that you should know. Many women do not really know this, and so many things have failed in their life. So if you are in knowledge of this, you can talk to that woman by your side who do not know this when you see that she's taking a decision that she's not supposed to take. Thank you for joining me today. Always like, subscribe, and always join our programs. We have so many programs that are lined up for the week that you are going to enjoy. Thank you for joining me today. I remain your host, Confidence.